Hi, everybody. Welcome. Today, we are going to be speaking about single and dating. You can be single and not date too, but it's for anybody who is single because I think most programs about sexuality focuses on partnered people, but I always want to spend some time speaking to people who are not partnered because there could be any number of reasons why you're not partnered. But sexuality should not be exclusive to partnered people. Um, Sexuality is something that, single people could also enjoy. So, I get a lot of questions, but please feel free to ask questions now in the chat, and I'll be glad to answer. So, the most common question I get about single and dating is, Um, I'm not dating, so I don't care about keeping myself in good shape. I don't need to do the moisturizing and things because, I don't have a partner. Well, it doesn't mean that you should not moisturize yourself. It doesn't mean you should not take care of your body sexually. You have to do, in my suggestion is do everything you can do to be your best self. If you need pelvic floor therapy, go ahead. If you need to do dilated therapy, go ahead. If you need to moisturize your vaginal walls, if you want to do lubricant, do it. Because self-pleasure is a great way. Self-pleasure, there are different ways people say it. They say self-pleasure, they say masturbation, they say whatever you want to say. It is a great way to prime your body and keep it ready. Even if you're never going to be in a partner relationship, self-pleasure is a great way to give yourself pleasure and to also keep your body supple and sexually healthy. So I highly recommend, and I give permission to anybody who's listening, who's single, to masturbate as often as you can. And you can always use fantasies, and, use some, if you need vibrator, you buy a vibrator, and really, you know, experience pleasure on your own. That's totally fine. And for those of you who are dating, the most common question I get is, should I tell the person I'm dating that I have cancer? Well, different people have different opinions about it. So you'll have to, kind of hear me and then decide what works for you. So what works for everybody else may not work for you. I personally think that when you're dating, you need to let the person you are going to go on a date with, all aspects of your life. You're not your cancer. You are, a teacher, a scholar, you're a painter, you're a, card player, you're a traveler, you're all these things. I think you should you should let your date know about all the wonderful things you are before you talk about your cancer diagnosis, because you do not want that to be the only thing you tell your date. And you know what? There are different kinds of people in the world. Those of you who have dated know that not all dating experiences are going to be great. And not everybody you meet on dates are going to fall in love with you. And not everybody you meet on dates you're going to fall in love with. There are a lot of people you don't, you meet once and then you're like, okay, fine, I'm, moving on. So if they cannot handle your cancer diagnosis, you may have to say, okay, this person's not for me, because at least in the beginning, this person will not be able to support you and be there for you. You don't want that person. So I would say, first, talk about yourself as a whole person. I always say put cancer in its place, in the corner. It's also there, but you don't have to talk about it first. You don't have to wear it. I am a survivor. I'm going through cancer treatment, whatever. Talk about everything else. And then you can, talk about your cancer diagnosis and fully expect them to be there or not be there. Some people will not be able to tolerate that. And that is okay because people who are not dealing with cancer also have a lot of rejections in the dating world. So it's not unique to cancer survivors. So anything else? Does anybody have any questions, comments, or any thoughts about what you'd like to hear from me beyond these things? Or has anybody gone through the experience of dating and what has happened and what can you share that would help everybody else in this group? So, I have also worked with individuals who tell me, oh, okay, I've gone on a date. I told my date that I'm a cancer survivor. They're fine with it. And now we have already been going out for the past month and a half, and they want to, get closer, become intimate. I'm very self-conscious about my scars. I'm self-conscious about the way my body looks. How do I handle it? So again, in this case, sexual communication is very important. We have talked about it all along in the last 5 sessions about the importance of telling people how you feel. Like you could say, first of all, it's fully within your rights to wear a lingerie, a night dress to bed. You do not have to be completely naked if you don't want to be. And, and tell them you're much more comfortable this way because your body has changed and this would help you feel comfortable. That's okay. Y- You know, this is your life, your body, and your date. So you are the CEO of this. You can do whatever you want. So you should tell them, this is what I want to wear. And if again, if they're fine with it, fine. If they're not fine with it, then they're not for you. And again, you can also say your body has changed and you have not had intercourse in a while because you have been single and you've also been having cancer treatment. So you're not ready for intercourse, but you'd like to cuddle and make out and try a little bit and see how far you can go with it. So do not grin and bear it. It's not normal, as I told you, to experience pain. So you do not have to go with someone else's timetable. The timetable is entirely yours. So, I mean, of course, you can be collaborative and say, I need some time. How do you feel about it? And then, start with non-penetrative sex, start with other forms of sexual interaction. And then, when you're ready, you can, kind of very gently engage in penetrative sex. First of all, use the dilators to make sure that you're fine and you can handle, penetrative sex, and then do it step by step. Everybody is very quiet today. I wonder why. Anything else? Let me think about other single people I have worked with. Um, there is a lot of anxiety about dating because, it is not, the whole online thing is good and bad, right? I mean, it's good because um, previously people met in person, like in a supermarket, or, they would go to church, they met church or some religious institution, they would meet there, like a synagogue, church, or, temple or something. So um, that is no longer because people are not really going out and interacting with others that much. Um, People are doing more and more. What is working, seems to be working more and more, are online dating things. So I see a lot of people have met and married through the different dating apps. So, when you're going through a dating app, you have access. The good thing is that you have access to people you would otherwise never meet. Um, I'm treating people who tell me I would never have met the person I met had I just not done it online, because this person is in a completely different field and is not in the area where she lives. And, but they connected. So you have this well of people who you would never have met otherwise. But, it also brings with it a lot of anxiety because you don't know who they are, and you need to really kind of test this out very carefully and also while being safe. So there are some issues that you may need to be worried about. Okay, so here it is. Yes, lots of anxiety about dating. I don't even know where to begin. You may begin by, first of all, taking care of yourself. You need to take care of your body, make sure that you're fine. The moisturizers, the lubricants, everything I told you, the self-pleasuring, all of it is really important. That's where you begin with, to everybody, whether you have had cancer or not, the first step to dating is taking good care of yourself. So you put your best foot forward. Okay. And then the second is, speak to other people who are dating and find out what are the different apps. And then you'll have to familiarize with that yourself with these apps. I'm married, so I'm listening to hear what others go through. I'm hoping to be able to help ladies in my support group with the information that you discuss. Oh, thank you so much. I really appreciate it. I hope you can help other people with the information as well. How do you approach self-pleasure when you've been told it's bad, inappropriate for society and others? Yes, different religious institutions and people kind of have negative opinion about self-pleasure. They feel that all sexual pleasure should come from uh, should be between married couples, and self-pleasure is it's not acceptable. I wouldn't go as far as to say sin, but they may call it that. I went to a Catholic school, so I kind of know, so I think this is, by the way, this is a common issue in most religions, and a lot of people have misconceptions about self-pleasure. So you will have to make a decision. We don't follow everything our religious institutions tell us, right? We pick and choose. We pick and choose. We don't, very few people follow everything. So that's one thing I can tell you. And this is a very important healing ritual. Self-pleasuring is a very important healing ritual. And so you may have to tell yourself, I'm doing it as a gift to myself. This is very important, and I'm going to do it. And I got permission to do it from a sex therapist, and I'm going to follow her. Yes, even purchasing toys seems weird. Don't even know where to purchase. Well, I did give you my resource list, right? On the resource list, there are sex shops, that online sex shops that I have mentioned. There is sexualityresources.com. It's run by a sex educator. It's run by a sex educator and a physician. Sexualityresources.com. It's on your resource list. So they actually deal with cancer survivors all the time and people who are going through cancer treatment. They actually have a separate section for cancer, people affected by cancer. So you could do that. You could also do the drawer. The drawer is, this is one of my student who has a sex therapy practice in Long Island, and she also has a boutique called the Drawer, and you get a discount if you buy from her because she knows that I speak to cancer survivors. So she's giving a 20% discount if you buy products from her. So she is also her program, her shop has sex therapists who can advise you on what to buy. So there are two big resources I've given you. So you don't have to really go and put your credit card into a website you don't know. These are legit websites. I know the person who owns sexuality resources. I know the person who owns the drawer. The sex educator who owns sexuality resources. I have met her at several conferences. She's a brilliant presenter at conferences. And the drawer is owned by one of my former students, who is also a professor at Widener University Center for Sexuality Education. And she owns a sex therapy practice in Long Island. So these are two very legitimate people, and you can absolutely go use their store. The only advantage to using the drawer is that you get 20% discount if you just write Sabita 20. That's the coupon code, and you get 20% discount. And I got this really good feedback. I bought a few things from that drawer. They were great, and my items arrived fast. This is excellent. And you can download the resource list and keep it for yourself. And you can, look at different products there, the dilators, where to buy the dilators. Most sex shops will have dilators. I would suggest buy the flexible, um, what's that, silicone dilators because they're easier and pliable. You don't want something that's hard. So use the more flexible ones. What else, folks? Do you have any other questions for me? I would say, it really, one of my clients told me it feels like I'm at the edge of a cliff and I have to jump off. And that's how anxious it makes me feel, this whole dating world. And I always say to this person, well, I know it's anxiety provoking. This is a completely new thing that you've never done before, and you're doing it. And this person, was in a long-term relationship and then got divorced and was single and dating and was also a cancer survivor. And so had all these other issues that were concerning her. Um, but, it's a chance you have to take. You may have to say to yourself, you can always meet for coffee. If you don't like them, you can walk away. You don't have to ever see them again. So when you tell yourself you have control over this, you do not have to do anything you do not want to do, then you will feel less anxious. Because most of the time, people get anxious because they feel they will lose control, that they may, once they step into it, it's like jumping off the cliff example that this person was telling me. Once you jump off, then you have no control and you're destined to experience whatever that experience brings. But you, in a dating situation, you have control. You have to tell yourself you have control. So at every point, you can choose where you want to meet. You can just meet for coffee and you can see them. If you don't like them, you can say thank you very much and leave. And you can send a text and say, or whatever correspondence, however you correspond to this person, and say, I really appreciated our time together, but I'm not ready to go through this at this point, or whatever you tell to kind of get out of the situation. And and if you see any red flags, you'll just let them go. And yes, I'm hearing this. I thank you for saying that. Um, it's also the fear of rejection and being alone due to my body changes. I hear you. I hear you. But remember, everybody who goes into the dating world is going to be rejected at least once. It's going to be rejected at least once, sometimes many, many times. So if you can tell yourself, it's not just me, everybody gets rejected. So I'm going to go in. If I get rejected, so what? And I'm going to reject people too. You're also going to reject people. It's not that you're going to go out with everybody who meets you. So it's an equal opportunity situation. So you're going to say, okay, I'm going to have the choice to reject them. They're going to have the choice to reject me. That's okay. And the physical changes, they are, once you tell them you have gone through cancer treatment and your body has changed, communicated ahead of time. If they want to run, they can run. You don't need to. These are not people who would, in the long term, be a good partner for you anyway. So, you basically are testing to see if this person is going to be around. If they're not going to be around, you don't want them. So I know a lot of people who have met their partner after they had their cancer diagnosis and treatment, and their bodies have changed. They met and got into long-term relationships with people. So it is happening. Not everybody out there is superficial and looking for perfect bodies. Okay? You may be alone for some time, but that is doesn't have, if you really want to be with a partner, and if you put the time in, you will meet someone. You will meet someone, and it requires negotiation. Listen, everything requires negotiation. Think about people, single women with kids. Think about people, and then there are, other people with digestive issues. There are people who have, skin issues, chronic conditions that they have, and they are meeting and getting into long-term relationships. So cancer is only one of the things that could change body, your the appearance of your body, and you need to kind of be aware of that and be creative in dressing up the way you want to dress, and even in bed you don't have to ever. If I know couples, I know individuals. I actually worked with a gentleman who had a liver cancer and had surgery, had a big scar, and and he basically figured out a way to conceal it during his time with his partners. So, or sometimes you may not need it, but sometimes it made him feel better to be wearing a t-shirt during, sex, even though his partner didn't care. Okay. Anything else? Let me think of anything else that has come up. But use the resource lists as much as you can, really. I put in a lot of information. And you know what? Look out for it, because as I get new information, I'll keep adding to it. I just found out about some new devices, and so I just keep adding new things to the resource list to make it more um, updated. So, and anytime somebody says, "Oh, I have a sex shop and I do this, I do that," I check them out and then I put it in the resource list. Okay. We are almost at the end of the class. So if you have any questions, I'm glad to answer it. I think I've read the entire chat, answered your questions, but if you have something else to tell me, I will be glad to talk to you about it. Okay, and don't forget, next week at 6 p.m., we have a class, an hour-long class for partnered people. And you can also come if you, whether you're single or partnered, you could be there because we're going to be talking about communication and how to connect with your partner. So even if you're not partnered at this point, you can attend this because you can learn skills that you can use when you find your partner. Resource list gets updated on which site? Oh, it's the resource list is actually in the Unite for Her website. So if I update it, I'll probably just send it to Sue Weldon, and she'll probably update it. Okay. So, um, folks, I am very honored that you gave me the time to come and speak to you. And I'm here and I've been part of Unite for Her for many years, and I love providing these resources and being there for people who have had experience with cancer. And I would love to continue this. So I will find a way to connect with you. Several times a year, I'll be doing presentations. So please be there, and I would love to see you all there because knowledge is power. Don't forget that. Knowledge is power. Once you get the knowledge, then you can make decisions, empowered decisions that will help you. Okay? Okay. Thank you very much.